Simone Scarlata. I'm a professor of medicine at the campus Bio-Medico University in Rome. When I select a new disposable instruments, I prefer those who were made for very quick and rapid onset and the initiation of the procedure, for a better suction environment and device, and for a very, very minimal setting procedure. I strongly believe that warranting for the best suction ever is a priority. We do not recognize the added value of having a very clear working channel, of a very clear vision, and the best and the quickest way to make the airways free from secretion, plugs, and even blood when needed. Suction is fundamental. It's the basic for having a very, very clear vision of your field of operating field, and the four is a basic prerogative you can never stay without. This would allow for future enlargement of the prerogative of disposable bronchoscopes. Just figure out what means having a very, very compliant bronchoscope that allows you for efficient suction, of course, for using a larger instrument, for taking biopsies, for using needle sampling, or even for moving forward ultrasound probes and newest material. Of course, the largest is better in this case. Of course, having a larger operating channel without making the bronchoscopy larger is an added value. And this is something that I guess many bronchoscopists will look with a real interest. I think there's no reason for considering not disposable bronchoscopy the only way to perform advanced bronchoscope procedures. Bronchoscope, a disposable one, will be reaching the highest standard needed for interventional procedures. I would have no problem with using it in a regular practice. We face every year an increase in the bronchoscopy demand in urgency and emergency procedures, and many of them are well suited if performed in a regular ward without the risk of moving the patient and issuing for contamination. You have to be able to perform emergency procedures, so you have to deal with unscheduled performance procedures, but also you have to warrant for lowering the risk of contamination, of moving the patient, and favoring the promiscuity and contagious dynamic ways. Due to the possibility of using disposable bronchoscopes in regular wards, this would really help in performing unscheduled procedures without overwhelming the bronchoscopy suite, and therefore accounting for a better management of the procedures.